So we will discuss in detail what is Bell's palsy, what are the clinical features, how it is diagnosed and how it is treated. First, the introduction part or the definition part. So what is Bell's palsy? So Bell's palsy, it causes sudden weakness of the facial muscles. This makes half of the face appear to droop. Smile is one-sided and half eye on that side resists closing. Bell's palsy, it is also known as facial palsy. It can occur at any age. The exact cause is unknown, but it is believed to be the result of swelling and inflammation of the nerve that controls the muscles on one side of the face. It may be a reaction that occurs after a viral infection. For most of the people, Bell's palsy is temporary. Symptoms usually start to improve within a few weeks, with complete recovery in about 6 months. A small number of people continue to have some Bell's palsy symptoms for life. Rarely, Bell's palsy can recur. So what are the symptoms of Bell's palsy? So signs and symptoms of Bell's palsy, they usually appear suddenly, and they include rapid onset of mild weakness to total paralysis on one side of the face, occurring within hours to days, facial drooping and difficulty in making the facial expressions such as closing the eyes or smiling or drooling of the saliva. The patient will have complaint of pain around the jaw or in or behind the ear on the affected side, increased sensitivity to the sound on the affected side, headache, a decrease in the ability to taste, changes in the amount of tears and saliva production. In rare cases, the Bell's palsy can affect the nerves on both sides of the face. Usually the Bell's palsy usually involves only one side of the face, but in rare cases it can affect the facial nerves on both sides of the face. So this is the picture showing the changes which occurs in Bell's palsy. So there is inability to close the eye, resulting in the irritation. So patient will have the inability to close the eyes. So there is a asymmetrical facial muscle tone, there is a sagging face, and there is a asymmetrical smile. So there is an inability to close the eye. So the patient is not able to close the eye. There is a drooping of the mouth, and this is the facial nerve supplying the face. And there is another picture showing the changes in the Bell's palsy. So there is inability to wrinkle the brows, there is a drooping of the eyelid, inability to close the eyes, inability to puff the cheek, asymmetrical smile, and drooping of the corner of the mouth, leading to the dry mouth. So these are the various signs and symptoms which we looked at in the patient of Bell's palsy. So now come to the causes. What are the causes of Bell's palsy? So although the exact reason why the Bell's palsy occurs isn't clear, it is often linked to exposure to a viral infection. And viruses that have been linked to the Bell's palsy include the viruses which causes cold sores and genital herpes, such as herpes simplex virus, herpes zoster, which causes the chickenpox and shingles, Epstein-Barr virus, which causes infectious mononucleosis, cytomegalovirus, adenovirus causing the respiratory illnesses, rubella, which causes German measles, mumps virus, which causes mumps, and influenza, which causes the flu. So these are the different viruses which can cause the Bell's palsy. With Bell's palsy, the nerve that controls the facial muscles, which passes through a narrow corridor of the bone on its way to the face, becomes inflamed and swollen, and it is usually related to a viral infection. Besides the facial muscles, the nerve, it affects the tears, saliva, taste, and a small bone in the middle of the ear, which now come to the risk factors. What are the risk factors which causes the Bell's palsy? So Bell's palsy occurs more often in people who are pregnant, especially during the 3rd trimester, or who are in the first week after giving birth, having an upper respiratory infection such as the flu or a cold, have diabetes. Also, some people who have the recurrent attacks of Bell's palsy, which are rare, have a family history of recurrent attacks. In those cases, there may be a genetic predisposition to the Bell's palsy. So these are the risk factors of the Bell's palsy. Now come to the complications which can occur in a patient of Bell's palsy. A mild case of Bell's palsy normally disappears within a month, but recovery from a more severe case involving total paralysis varies, and the complications may include irreversible damage to the facial nerve. So the Bell's palsy may cause permanent damage to the facial nerve. There is a misdirected regrowth of nerve fibers, resulting in involuntary contraction of the certain muscles when trying to move others, which is known as synchinesias. For example, during the smiling, the eye on the affected side may close. partial or the complete blindness of the eye that won't close due to excessive dryness and scratching of the cornea. So there may be exposure keratitis. Now come to the tests and diagnosis. How will you diagnose a patient of Bell's palsy? So there is no specific test for Bell's palsy. Usually the diagnosis of Bell's palsy is clinical. Doctor will look at the face and ask to move the facial muscles by closing the eyes, lifting the brow, showing the teeth and frowning, among other movements. Other conditions such as stroke, infections, Lyme disease and tumors, they can also cause facial muscle weakness, mimicking the Bell's palsy. So these conditions come in the differential diagnosis of Bell's palsy. If it is not clear why having the symptoms, certain tests may be required, including, so in certain cases some specific tests are required. These tests are electromyography, that is EMG. This test can confirm the presence of nerve damage and determine its severity. An EMG measures the electrical activity of a muscle in response to stimulation and the nature and speed of the conduction of electrical impulses along a nerve. So in doubtful cases, the EMG can be helpful in confirming the diagnosis of Bell's palsy. Certain imaging stains like MRI or CT, they may be needed on occasion to rule out other possible sources of pressure on the facial nerve such as tumor or skull fracture. Now come to the treatment part. How will you treat the patient of Bell's palsy? The most of the people with Bell's palsy, they recover fully with or without treatment. So the prognosis is good in majority of the cases. There is no one size fits all treatment for Bell's palsy. So there is no universal treatment which is suitable to all the patients of Bell's palsy. But certain medications or physical therapy may be needed to speed the recovery. Surgery is rarely an option for the Bell's palsy. So commonly used medications to treat Bell's palsy include corticosteroids. So corticosteroids are commonly used to treat the Bell's palsy. In corticosteroid, prednisolone is commonly used. Prednisolone, it is an anti-inflammatory drug which reduces the swelling of the facial nerve so that it will fit more comfortably within the bony corridor that surrounds it. And the corticosteroids, they work best if they are started within initial days of symptoms started. So corticosteroids should be started when the disease starts. They should not be started in the later part of the disease, because the chances of response with corticosteroids is better when they are started in the initial days of symptoms. Antiviral drugs, the role of antiviral drugs remains controversial. Antivirals alone have shown no benefit compared with placebo, and also the antivirals when added to steroids, they are also unlikely to be beneficial. So the role of antiviral drugs is controversial in the treatment of Bell's palsy. However, despite this, acyclovir, valcyclovir, it is sometimes given in combination with prednisolone in people with severe facial palsy. Apart from the drugs, physical therapy is very helpful in the patients of Bell's palsy, because the paralyzed muscles, they can shrink and shorten, causing the permanent contractures. A physical therapist can teach how to massage and exercise the facial muscles to prevent this from occurring. So the patient should be directed for physiotherapy. Surgery. In rare cases, the surgery may be needed in patients of Bell's palsy. In the past, the decompression surgery was used to relieve the pressure on the facial nerve by opening the bony passage that the nerve passes through. But today, the decompression surgery, it is not recommended, because it will lead to the facial nerve injury and permanent hearing loss. So the role of surgery is very limited in the patients of Bell's palsy. In rare cases, the plastic surgery may be needed to correct lasting facial nerve problems. Now come to the lifestyle and home remedies for the Bell's palsy. So the home treatment may include protecting the opened eye, because the patient will not be able to close the eyes, so it can lead to the exposure keratitis or chances of blindness. So you should lubricate in eye drops during the day and an eye ointment at the night, which will help to keep the eye moist. And wearing glasses or goggles during the day and an eye patch at the night can protect the eye from getting poked or scratched. So you should protect the opened eye. Taking pain relievers can be taken to relieve from the pain, like aspirin, ibuprofen or acetaminophen. And applying the moist heat, putting a cloth soaked in warm water on the face several times a day may help to relieve the pain. And during physical therapy exercises, massaging and exercising the face according to physical therapist advice may help to relax the facial muscles. Some alternative medicines are also suggested for the treatment of Bell's palsy. Although there is little scientific evidence to support the use of alternative medicine for people with Bell's palsy, some people with this condition may benefit from the following. Some relaxation techniques. Relaxing by using techniques such as meditation and yoga may help to release muscle tension and chronic pain. Vitamin therapy, vitamin B12, vitamin B6 and zinc, they may help in the nerve growth. So these are some famous personalities which also suffered from the Bell's palsy in their past, but they are usually get recovered, like George Clooney, Pierce Brosnan, Sylvester Stallone, Angelina Jolie. So these all famous personalities have suffered from Bell's palsy, but they will recover from their Bell's palsy. Thank you.